everyone see it? Okay, awesome. All right. One slight correction, I am still in grad school right now, so at Georgetown. Almost done though. All right, so my name is Andrea. As Matthew said, I'm presenting on COVID-19, race, and hospitals in the United States. I'm just going to show a viz that, or some vizzes I made in Tableau today. But first, I'm going to give you some background information so you can understand the context. And you can follow me on Twitter or Black Ties or Black and Data on Twitter. All right, so first I want to talk about the history of hospitals and hospital beds in the United States. Basically, in 1946, there was an act to basically, it funded the construction of more hospital beds across the United States. The only problem was this was tied to the income of the area for the hospital. So this actually helped expand more hospitals in like the rural South. So it did help communities of color to get more access to hospitals. The only downside is after the civil rights movement, there was desegregation and a lot of people moved out of the areas, like kind of the urban centers where a lot of people of color were. So it kind of decreased the amount of funding to these hospitals. So these hospitals ended up having to decrease their amount of their acute inpatient beds and acute inpatient beds, and they had to increase their outpatient beds to make money. So this created that's a problem because when we have like COVID-19, basically a lot of communities of color don't have enough acute hospital beds to treat their patients. So let's go to the next slide. All right, and then I'm gonna give you a quick background on the COVID-19 and timeline. I'm sure everyone knows this. The first case was in China, and the first death was in China, and the first United States case was in Washington State, and the first death for the United States was in Washington State. And then around April 9th, the New York Times had an article about how Blacks and Hispanics had twice the death compared to Caucasians from COVID-19. And during that like late March, early April, there's a large public amount of pressure to get public health departments to publish information publicly by race, because it was obvious that communities of color were being impacted more, but there wasn't data to back it up. So around April 13th, this is when the data started being published by race for each state for COVID-19 deaths and cases. And then some more background information. This shows a chart over since the beginning of the time when the race data was collected, that basically Blacks and Indigenous Americans have experienced the highest death tolls from COVID-19 in the United States. And this is updated as recently as November 10th. So you can see the trends over time. And we'll go to the next slide. And now I'm going to show you some of the dashboards I made. So the first one I'm going to show you is the cases dashboard, which would be this one. So for this one, you can filter it by race. So the red means they had a high amount of cases, and the green is a lower amount. So this is the total overall cumulative in the United States. You can see here, this is the last time I updated this was last night, it automatically updates. So you have cases for African Americans. If you click on this, it'll show you where most of the cases have been since the beginning of since beginning of April, when the race data was collected, have been in Florida, Georgia, basically the South, where most of the cases for African Americans have been. And then for the Asian American population, most of their cases have been in California. And then if you look for the Hispanic group, most of their cases have been in California and Texas, not Texas, and in Florida. And then this is basically the trend since beginning when the data was collected to the update I did last night. So we'll go to the next one, which is for deaths. And so this is deaths since the beginning of the pandemic. So this is deaths total. So this is the overall amount of deaths for each state. And it filters by race. So we'll click on Black, and you can see most of the deaths for African Americans have been in New York State. I know this isn't per capita or anything, but that's something I'd like to do next. And this is overall since the beginning, since the race data started being collected, was the overall trend for African Americans deaths in the pandemic. And then you can do it for other groups too. And then you can see for Hispanics, it's been California, Texas, New York, and so on. And then another one I made. So this is for ICU beds. This is based on CDC data that the last time it was updated was July 14th. So that's where the data is, the number of ICU beds per state. You can see, oops, you can zoom in and out. Click on this one, like Texas has 9,000 ICU beds. And you can see we're the bottom 5 states with the amount of ICU beds and top 5 ICU states with ICU beds. And then I have another one that I made with inpatient beds. Just so you can see the amount of where the inpatient beds, a high amount of inpatient beds are. So the highest amount is in Florida and California, and the lowest amount is in, let's see, Vermont and Alaska. So ideally, I would like in the future to have more granular data to combine this, maybe at the county level, so I can kind of overlay like the race data with the hospital beds per capita, something more granular, but I haven't seen that data yet. So if anyone knows where that data is, I would love to see it so I can make a more detailed visualization. And let's see, next. So how do I do this? Basically, I have a Python script that I wrote that automatically downloads the COVID-19 racial data every day, and I automated it with Windows Task Scheduler. And I got the hospital data from the CDC, and I did join it at the state level, my data, and create worksheets and Tableau, and it was lots of parameters and filter actions and everything to create it, and then I just published it to Tableau. And these are some references, so if anyone's interested in trying to create a viz, this is kind of what I read to learn how to do this. And acknowledgements, because I got this initial idea from Jasmine and Jamita. And questions. Hopefully I didn't go too fast. Let's see. Alrighty. Let's see. Do I see? All right, so I think I have questions. Windows Task Scheduler, basically it's a program within Windows where you can automate anything. So you can set it to basically pull up a Python script and execute it at a certain time every day. So that's what I did. That is a great question. I did not have that data by Black Hispanics. So it depends on, there's COVIDtracking.com that has like the race data. So it depends on what they said, which I don't remember seeing anything about how they divide up Black Hispanics. And somebody wants to see my resources slide. All right, we can go back. I think that resources, there we go. What are my plans for future analysis with this data? Right now, I'm probably just going to look for more detailed data so I can do compare the race and basically race and like the amount of hospital beds per like county, so I can just see which where the disparities are. And then what do I do as a data scientist in my company? All right, so I'm a data science fellow at the FDA. So basically, I create data visualizations with drug safety data. So like, for example, I'm not working on this, but there's like COVID-19, when the vaccine's released, if there's ever some adverse event, it has to get reports to FDA, and then there's somebody that analyzes that data, and that would be me, but I'm not working on that project. And then I do create data visualizations and maybe natural language processing for some of the safety reports, because it's like a form that different manufacturers and doctors send to the FDA that lists all their safety information if someone has a reaction to something. Is the Python script readily available online? I found it. No, I wrote it myself, but I'm sure I found something online that helped me to figure out what I needed to write in my Python script, but I didn't. I can share it with you if you're interested. Let's see. Any other questions? Can you let us know how you learned Python? I have a document I can share with you. If you like tweet me at ehobby9, I can share it with you of what I used to learn Python. No, that I got my data scientist job like a couple months ago. So I literally just started my first data scientist job. And I'm at the end of my master's program. Let's see. And someone, can you describe your education professional background more? All right, so I graduated from Wellesley College a long time ago. And I worked for a while in clinical research and clinical trials for about 10 years. So I have a lot of, I guess, subject matter expertise, which is probably why I got hired at the FDA. And then I started my master's program like in 2019 in epidemiology, and over the summer I did a certificate in data science. And then over the summer, that's when I found my fellowship at the FDA, and which I started in basically late August, early September. And yeah, so that's where I'm at right now. Let's see, are there any data blogs and websites by Black folks that you enjoy or recommend? Honestly, only thing I know is Black in Data and Black Tides. I'm sure someone, if you tweet at one of those Black in Data or Black Tides, someone will have better information on data blogs by Black folks. But maybe I should create one. I don't know. Are there free versions of Tableau? I have Tableau. Yeah, I have the student version through school, and then I have the professional version or whatever through my job. So I do not know about that, but I'm sure I can follow up about that. Thank you for posting my Twitter. And Data for Black Lives, I guess, might be a good blog to follow. Any other questions? Any other questions? Let me know. How do you manage or hope the data visualizations like this will be used in reporting? I think it would be useful to have more, I guess, detailed data just to know, like if there's, because I know, like I heard this one story, like on the border of Mexico and like Texas, that there's not a lot of hospitals and there's not a lot of hospital beds, and there's like COVID rampant everywhere. So I'm like, of course, people are going to die if you don't have enough acute care beds and ICU beds to treat them. So I would like to have more granular data at the county level just to be able to kind of show that better. What am I currently learning? Right now I'm in epidemiology programs right now, taking like a health disparities class, but over the summer I took a class on like vaccinology and molecular epidemiology, and what else have I taken? I've taken cancer epidemiology. That's my concentration. What will I do next? We'll see. The national COVID dashboard that the president-elect plans on rolling out. I have not seen that yet, but it needs to be done because what we have so far, like the CDC data that I had, I think it stopped getting updated because the current president interfered with that somehow, or the current CDC director. So hopefully with the president-elect, we'll have a better dashboard that continually updates data and is more transparent than the current administration that's about to leave. Let's see. Any other challenges in the process? I guess the challenge is I have to read everything myself because I'm basically the Tableau expert at my job, and so it'd be nice to bounce questions off of people sometimes. So it'd be nice to talk to more people. So maybe I guess the challenge is I have to learn everything on my own without having someone to go talk to. So. And anything else? Any other questions? I can post my resource slide on my Twitter after the talk is over, if that helps people. We will be working on accessing the recording, or we'll upload the recording. We have a tech team that's working on that for all the presentations, so. Any other questions? Yes, masks during Thanksgiving, and don't go home. Keep your mom, your parents, and your grandparents safe. Wear your mask, and like, I'm from California. I'm not going to go see my family this holiday season because of the rates of COVID is too high. So I'm just here in Maryland, wearing my mask and keeping my family safe in California. Biggest challenges inside my role. I guess I would say the FDA does have limitations to their abilities technology-wise. So I'm like, it's not like you're Facebook or Netflix where they have unlimited resources. There's budgets, So there's only so much you can do with working at the federal government. But I'm like, it's fine for me because I'm not, I guess, high up enough yet where it really makes a difference in my job. So. I found my current position. It's on a place called Zentellect. Let me see if I can find it real quick. I can post it in the chat real quick if that helps people. Now if I can find my presentation again. There we go. And any interesting takeaways from the dashboard that weren't expected? Honestly, I think I've been following the news pretty closely, so it wasn't unexpected to me what I saw, but I'm sure to other people that probably haven't been following the news as closely, it might be surprising just to see the patterns of where like the deaths and the cases are and like where the hospital bed, ICU beds and inpatient beds are. Let's see. No, my job is not a typical work from home position, but the federal government is good with allowing the option. Like if it wasn't COVID, I would still have the option to work from home, but maybe like twice a week instead of like every day. Oh, somebody posted, looks like a blog, a Tableau Zen Master. So that's awesome. I'll check that one out too. All right. Any other questions before we wrap it up? I see lots of thank yous, so thank you for coming. Thanks. Yes.
Well, thanks, Andrea, for giving us some wonderful insights today and showing us some cool things we can do with Tableau. It was a pleasure having you and having you answer especially our questions from the audience. We will be sharing the slides and recording, so please do keep in touch with Black and Data Week to get that information later. Thanks again, everyone, for joining.
Thanks.